Number 3, smart brain prosthetics. Researchers are now creating and testing implantable wireless brain devices to stave off depression or block memories triggered by post-traumatic stress disorder, PTSD, as well as to help those with severe physical limitations to move again. The question is not whether these devices can be created to successfully interact with the brain, but how and when they will be available. A skilled team comprised of dozens of Massachusetts-based bioengineers, molecular biologists, neuroscientists, physicists, computer scientists, psychologists, material engineers, and neurosurgeons are now at work on an implantable neuroprosthetic device that can sit inside a patient's head, pick up the onset of depression or PTSD, and stave it off before havoc can occur. If this smart brain prosthetic works as expected, it will not only restore quality of life for those affected, but dramatically change the way neuropsychiatric disorders will be treated in the future by offering a therapy that is more precise, more targeted, and with no side effects. In addition to prosthetics to relieve depression, neural engineers are also developing brain prosthetics to help restore physical function to the millions of people who are paralyzed or who have had limbs amputated. With the goal of developing prosthetic devices that are driven by brain signals that will allow paralyzed people to regain function by rewiring their brain directly to a prosthetic limb, work on restoration of function with brain prosthetic interfaces is now taking place with human volunteers in several U.S. research laboratories. The hope is that one day soon, these smart prosthetic devices will enter into real-world usage and significantly improve the lives of people whose physical movements are severely impacted by stroke, neurodegenerative disease, or accident or other traumatic injury.
So we have Dr. Emad Eskandar with us, who is rapidly advancing these sorts of approaches. And Emad, can you tell us, now that there's the prospect of having this closed-loop thermostat-like read-stimulate device, where do you see it going first? Once the technologies are further optimized, are there certain patient populations or disorders that you see as being early on targets, no pun intended?
Yes. So probably the most straightforward disorders to treat are the ones where we have the best scientific understanding. So for instance, post-traumatic disorder, stress disorder, we think we have a reasonable understanding of the underlying neurocircuitry, so that would be one of the first targets. And then from that, we would likely proceed to things like depression and drug addiction, and then it gets, and then we have to kind of wait for the science to catch up. But we have certainly in mind a progression of what we want to tackle first.
And do you see this as being more widespread eventually, or being mostly confined to refractory or severe patient problems?
It's hard to predict what will happen. Certainly in the beginning, we'll treat the most refractory patients, and then over time, then one could consider intervening earlier. That's been the trend in these devices generally, that the earlier you intervene, the better outcomes you have and the longer period of high quality life the patients can have. So it's better to intervene early and salvage a patient than wait for after they've had 20 years of disability. As far as the device goes, I just want to make one more point, which is that our understanding of these disorders has really advanced significantly. And now we really view them as network disorders, that they're not just particular nodes or particular neurotransmitters, and that they're dynamic. And so, the device is intended, or these kinds of devices are now intended to really address this at a network level by having multiple areas of recording and stimulation, to be dynamic and to be responsive in real time. So that's kind of the big insight.
Thank you.